Hi, this is Ming Chu, the injury guru. I had a previous post and I was talking about the medial meniscus, and this is part two of the medial meniscus discussion. And as you know, I'm a physical therapist here in New York City, and I specialize in soft tissue. And I'm the author of The Permanent Pain Cure, the how-to book on how to cure your own pain. For those who follow professional basketball, Zion Williamson recently hurt his meniscus. Now, Zion Williamson is a very young man. I don't think he's even barely 20 years old, and he's only 6'7", and he weighs 285 pounds. To put this in perspective, in my opinion, a person of that size in the NBA, obviously he has a different body type, should weigh considerably less than 285 pounds for a 6'7" professional basketball player. To me, the perfect body in professional basketball player is probably Kawhi Leonard. I mean, he's lean, he's muscular, he's strong. He's also 6'7". He only weighs about 230 pounds. He also happens to be probably the best player in the NBA right now. He's actually my favorite player. So comparing Zion Williamson to Kawhi Leonard is probably not a bad thing to do, just to look at body types. But I believe for a man so young, for Zion to injure his meniscus it's not a good thing for a person who just started playing in the professional ranks. I also discussed in my previous video that one of the things that most orthopedic surgeons do when there's a tear inside the meniscus is they tend to cut around it. They call it debridement, meaning they cut out the sections around the frayed areas of the meniscus. To me, I'm not sure why they do this. It doesn't really seem to make sense unless it's really blocking the joint movement. I personally had 2 meniscal tears, and I had my knee locking as well. But I also did not panic. I did not do the surgery route, and I just rehabbed my knee by myself because I'm a physical therapist. I'm supposed to know these things. And the knee clicking and popping just resolved by itself after about 3 weeks of doing my own set of treatments. And to tell you what I did, I went through this in the other video, but I'll go over it again. The first thing I did was I set up my knee on a microcurrent machine. And a microcurrent machine is a type of electrical stimulation that's not what you typically see in regular physical therapy clinics. The microcurrent offers very low levels amount of energy in terms of milliamperages, which is very low level. It doesn't cause muscular contraction. You hardly even feel it. And that's designed to increase the amount of ATP in the area where it's being treated. It also stimulates the production of collagen and connective tissue, which is exactly what I needed. So on the first few days when I hurt my knee, I put on the microcurrent for almost 1, 2, 3 hours a day for the first few days, and it significantly improved the pain. My pain levels were about a 7-8, and after I did that for about 3 days, the pain levels went down to about a 5-6. After I did that, or during the same time, I was implementing using extensively Chinese herbs, and I was using Zhou, which is a Chinese herb that I've talked about extensively in one of my past posts, and I was applying the Zhou Chinese liniment on my knee about 3 times a day. And I did this for at least a week. And then I continued to do at least once or twice a day for another few weeks. And that also took out a lot of the pain and the inflammation. Mind you, I never ever used ice during this period, which unfortunately that's what the people in the NBA do almost reflexively. And I've always said, I've been doing this for 20 years, I think ice is overused, and I think it impairs the natural healing processes of, say, a torn meniscus. I believe that the swelling that I had, which I had very extensive swelling inside my knee, it was the size of a third of an orange. It was very frightening. But I also realized that this is a natural occurrence, so I let it happen. And all I did was put on Chinese herbs, and the Chinese herbs never froze the area down. In fact, it accelerates the healing process. That's the purpose of the Chinese herbs. And within a few days of using the Chinese herbs and the microcurrent, my knee was, like I said, significantly better. Right around this time, I also was implementing something called photonic light therapy, which is a modality that I use in my office, which has red light, blue light, and far infrared light. And this light also is designed for increasing blood flow, lymphatic drainage, increasing ATP, increasing nitric oxide, which increases the capillary beds to open so there's new fresh blood that can be brought into the area. So the key component of this is to increase circulation. So if you use ice, it actually constricts your tissue and doesn't allow the nutrients to come in. It doesn't allow the hormones to come in or the macrophages and the leukocytes to clean out the area. So that's why I'm very much against using ice. Instead, I use the microcurrent, the photonic light therapy, as well as the Chinese herbs. I also use Chinese herbal patches. You can buy these patches in Chinatown or any place that sells these patches, and you can put it on your knee. And I was using those pretty extensively too for the first week. And they do seem to help, and it took away a lot of the pain, like I mentioned. Right around week 2 or 3, when the swelling had gone down significantly and the pain had dropped from like a level 7, 8 down to right about a 4. I no longer was limping. I started going back to the gym. I did not squat, but all I did do was every other day I would ride the recumbent bike, which is a bike, a stationary bike where you sit down on it and your legs are kind of in front of you, so there's very little weight on the leg. So I would ride the bike for initially 5 minutes at a very low tension, at a moderate pace, just to get blood flow and fluid flow going through the knee area. Keep in mind that the meniscus has a very poor blood supply, and some of the nutrients actually comes in through regular diffusion, doesn't even come through the blood vessels. So the significance of that is you need to move the knee without stressing the meniscus. And the solution to that was what I concluded was by doing the recumbent bike at an easy pace with very low tension for just a few minutes. I started out at 5 minutes. I did not go past 10 minutes. And the knee definitely felt better afterwards as it got more lubricated and more growth factors and healing factors started entering that area. So I would do that approximately every other day, and I would go no higher than 10 minutes. And then the following week after that, about week 3 or 4, I started including a very light leg extensions. It's when you sit down on the machine and you extend your leg. And I would do 2 or 3 sets of 12 to 20 reps with a very, very light weight, not going to failure. And I would do the same thing for a leg curl machine, which worked the hamstrings. I noticed that within 2 or 3 weeks, my quad had definitely atrophied in such a short period of time, but I didn't worry because I knew that the muscle development will come right back. So I did this leg extension, leg curl routine for about 2 or 3 weeks, and sure enough, it did help. And I noticed something interesting happen around week 5 and week 6. I remember going to sleep and my knee was throbbing in the middle of the night. It woke me up for 3 consecutive nights. And I did not think it was a bad thing. I actually thought it was a good thing because I felt that it was in the process of really suturing and healing itself, and the body was just very uncomfortable in the middle of the night. And I felt that after those 3 nights when I had that series of night pains that woke me up, the knee felt significantly better. So after around week 6 or 7, my knee pains were probably like a 1-2. It wasn't that bad anymore. I was functioning. And that's when I started doing body weight squats along with the leg extensions and the leg curls. I stopped doing the heating pad. Also, I forgot to mention, I was also using the heating pad from week 3 on. I would do the heating pad on days that I did not do exercise on my knee, which is about 2 or 3 days out of the week. I would use the heating pad for 1 hour on my knee. And during this whole time, since day 1, I was also implementing 4 tablespoons of powdered collagen. I was using a joint support product by Dr. Mauro Di Pasquale. I was using about 16 to 20 pills a day. And I was also using liquid hyaluronic acid, which I took orally, 2 teaspoons a day. And I was also using a powdered MSM, which I took 1 teaspoon once a day with water. And I was making sure that my body was fully hydrated, and I was drinking at least 3 liters of pure water every single day. So if you have to make sure that you give the body the right raw materials to heal. So now, fast forward, I'm at about week 6 or 7. I'm pretty much almost pain-free, but it's still a little stiff. And as I approached around weeks 10, I felt I was pretty close to 100%. My pain levels were probably down to a 0.5. And pretty much after week 11 or 12, I was back to squatting, back to running, back to riding my bicycle. I was pretty much 100%. Sadly, the same thing happened to my right knee just about 4 or 5 months ago, and I used the exact same approach. And sure enough, my right knee is pretty much perfect right now. So this was to support the first video that I did the other day, that this is a much more detailed description of what I did for my knee. But I also did some soft tissue work around my quadriceps, specifically around the kneecap and around the inside border of my knee, around the medial meniscus, which where my problem was. And I also employed a deep tissue massage therapist, and I had her work on my hamstrings, my quads, my calves, and my IT band, and my adductors. Everything surrounding the knee was treated. And I also treated myself because I'm a soft tissue therapist for the things that the massage therapist missed. But between all of that, I managed to heal my knee without surgery, without using ice, in a matter of less than, depending on how you calculate, around week 6 to weeks 10, I pretty much was healed. So I wanted to pass that on to you, and hopefully Zion will lose some weight. I think he's way too heavy at 285 pounds. I think realistically he should be about 250 pounds at most. Mind you, Kawhi Leonard's only 230 pounds. They're totally different body types. I understand that, but even still, I think his weight is way too heavy. Hopefully Zion's people will advise him, and hopefully the doctors won't cut out too much of the meniscus, because as I said before, if you cut out pieces of the meniscus, it does not allow for the shock absorption to occur. It does not allow the body to prevent torsional stresses, which is the design for the meniscus. So hopefully he gets the proper surgery, and hopefully he gets the proper therapy, and I hope he doesn't use ice. I hope he uses Chinese herbs and some of these key supplements. For those out there who have knee pains, it's just a different way of looking at things. This video is not intended for you to use this instead of getting professional advice. I suggest that you find a good therapist that can think outside of the box. You don't have to trust me because I'm just another face on YouTube, but do find someone that understands using modalities like microcurrent, light therapy, Chinese herbs, soft tissue therapy, and the right type of resistance training at the right time. If you can find someone like that, that person can help you steer you through any type of therapy without any mishaps. So once again, find a good therapist, and this video was not intended to replace that. So good luck for those who have knee pains. If you have meniscal problems, I hope this video helped you, and good luck, and hope your knees feel better. Take care. Bye-bye.